Do you have chronic pain? If you're answering yes, then you need to watch this segment. Colin McDonald is here from Wasatch Pain Solutions, and he brought a special guest, Dolores, right? This is Dolores.
This is Dolores.
We've not seen her on TV before.
Right. Yeah.
And this is her first time.
This is her first time. She's very nervous.
So it's a female?
Or
sure. Does it matter?
Yeah, no, today she's
a female. Okay.
She just received her name, actually.
But we're talking about chronic pain, and
Correct.
what are the areas that you see chronic pain the most in someone?
We see chronic pain, well, we see chronic pain in a couple different ways. We see it when people oftentimes have an injury or wear and tear issues. This can happen very quickly, or it can happen over time. We have good ways of treating both of those things, and oftentimes we can help people kind of achieve their goals. We get runners back on the trail, we get athletes back on the field. We sometimes our patients' goals are as simple as I want to play with my kids and not pay for it later. And it's honestly, it's the best part of my job to see those goals achieved and to see people get back to what they want to do.
What's the definition of chronic pain? Because I just moved and picked up too many things and my whole body hurts. But and you said that'll probably go away. Like do some ice and some ibuprofen. And but chronic pain is where it's continuing for a long time.
Right, and you can have acute pain that will be chronic pain. So something like that, if you herniated a disc perhaps, and we'll talk about that in just a moment, but if you herniated a disc and that's creating pain that's shooting down your leg, that may become a chronic issue that needs attention pretty quickly so it doesn't become a chronic issue for the rest of your life. And so that may be something, but if it's just kind of wear and tear, aches and pains from something like moving, then it likely will go away pretty quickly. So 6 weeks is usually the time
6 weeks,
when we say
okay,
that's
all right.
issue.
And the areas you see most that people come in and say, this is where it's bothering me, or what?
So probably number one is the lower back, which is pictured in the green here on Dolores.
I like the color coding.
Thank you very much. So this is the lumbar spine, 1, 2, 3, 4, 5. And you have bones that are the structure of the spine, and then you have discs which do the compression management of the spine.
All right, so where's my belly button in the front? Like just so I know how low the back
right
goes.
Up here. So
this, right up here. Okay.
This is your hip right here, and that's correlating with L4. So if you kind of take your hand and put it right at your hip, that's going to correlate to your lumbar spine pretty well.
All right, and then that area is below.
Correct.
All right, and then the other part that you're
The other part we see is the
neck.
neck. So the neck includes the head, the shoulders, and the arms, much like the lumbar spine includes the hips and the legs as well. So if you're having pain that's shooting down your arms or your legs, that can oftentimes be coming from your back, and that's something that people have a hard time understanding at first.
So when people come in and complain of their chronic pain, what do you do?
We initially evaluate them, so we try to use the best methods possible. We do a physical exam, we use the history, and we oftentimes get imaging like an MRI to show us what's going on with those issues. We can evaluate what the problem is and then start treating the problem. So the two most common problems we see are, I like to break it into front of the spine pain and back of the spine pain. So front of the spine pain is these disc herniations, which is illustrated here on Dolores at L3, L4, and that's pushing on this nerve, which is exiting the spinal cord and running down the leg.
And it's debilitating, really. When you have that kind of pain, it's so hard.
Right.
And the neck, too. I mean, when your neck hurts, you can't turn your head. I mean, so what are you treating? How are you treating this?
So in the case of a disc herniation, we would be going into that area and creating an anti-inflammatory effect by placing an anti-inflammatory product near the area of impingement, near the area where the nerve is getting pushed on by the disc. If it's a joint problem, we're going to focus on turning off the signal of a nerve that's running from the joint back to the spinal cord. And that usually gets people relief pretty quickly, and then we just kind of monitor those patients for 6 months to a year, make sure they're doing really well, and then start to help them improve long-lasting or get long-lasting effects.
Oh, that's wonderful. So if I went in with back pain and you treated me, when would I really see the effects of it?
Pretty quickly. It depends on what's going on, but within days to weeks for all of our treatments, and then we just kind of follow you along and make sure you're doing really well.
Oh, that's fantastic. I mean, it's life-changing for so many people.
Yeah.
So Wasatch Pain Solutions, you do consultations, right? If I need to come in and see, that's when you do the whole assessment, and we'll just see how
exactly right.
What turns out to be my problems.
Exactly right.
And hopefully you can fix them and fix them quickly. I love it. Colin, thank you so much. WasatchPainSolutions.com. They're in South Jordan and in Pleasant Grove, so a couple of locations. And we'll put all the information on our website. So if you're feeling like you're in pain right now, you can get help soon.
Thank you.
Colin, thank you. And Dolores, she did
great.
Of
course. She was nervous.
I know.